Good morning. My name is Cheryl Reguer, and I have the great privilege to serve as the Vice President and Provost of the University of Toronto. And today it is my honor to welcome you all here to the University of Toronto for this important announcement. And in particular, let me welcome our distinguished guests, the Honourable Deb Matthews, Deputy Premier and Minister of Advanced Education and Skills Development, our Minister, and the Honourable Eric Hoskins, the Minister of Health and Long-Term Care. And we're absolutely delighted to be able to host this announcement this morning here at the University of Toronto in our newly renovated Student Success Centre. This area was renovated and just opened in February, and it brings together in the same space a number of services that were located across the university in disparate locations. And really this whole building is a one-stop shop of student services here at University of Toronto. In this particular space, the university supports our students by helping them with such things as securing housing, supporting them in achieving academic success, and assisting them in planning for their career success. All things, as we know, that contribute to good mental health. As most of you are aware, we are coming to the end of exam season right now, and the staff right here in this centre, amongst staff across the university, we're dedicated to helping students succeed during what can be a challenging time for some of our students. Let me just give you an example of one of our programs, which is called From Intention to Action, or FIT. And this is a program designed to provide one-on-one ongoing support for students who might feel overwhelmed by pressures, stress, and anxieties that all have a way of getting in the way of academic success and academic progress. So the FIT program provides supportive counseling, builds skills in stress management and time management, and offers learning strategies. And just outside this particular room that you're in, or suite of rooms that you're in, is the university's Health and Wellness Center, where students can access a full range of mental health services provided by members of the multidisciplinary healthcare team. So, again, welcome, and we're glad that you're here. And let me begin by introducing our Minister Matthews. She is first elected here to provincial legislature in 2003 in the riding of London North Centre. And over the last 13 years, she has been a dedicated member of the provincial parliament and has held a number of key cabinet roles, including Minister of Health and Long-Term Care and President of the Treasury Board. As I mentioned, she currently serves as the Deputy Premier and the Minister of Advanced Education and Skills Development. Minister Matthews.
Well, thank you, Cheryl, and good morning, everyone. Thank you so much for joining us today for an announcement that will have a real impact on the lives of students. So thank you for being here, and thank you for being advocates of students. I want to start by acknowledging that we are on the traditional territory of the Mississaugas of the New Credit, and I do want to show my respect for their contributions and recognize the role of treaty making in what is now Ontario. As the Minister of Advanced Education and Skills Development, it's my job to make sure that our students succeed, that our students have the ability to achieve their full potential. And to do that, we need to make sure that students are getting the support they need. It's one thing to get accepted to college or to university. It's another thing to thrive when you're there and to successfully complete. We need to make sure that when students need help, or they need someone to talk to, or resources to inform them, that they can turn to high-quality supports. And that's what we're here to talk about today: health services and supports on campus. And I am delighted that my colleague Eric Hoskins is here today as well. He'll be talking about some of the support we're providing for Pharma care, OHIP, and more. What I want to talk about is mental health. I can tell you that as I have traveled the province, meeting with students, meeting with faculty, meeting with administration, the theme that I hear every single meeting is about the need for more supports for mental health. I hear it everywhere I go, in every part of the province, from everyone I meet with. So I hear that students can be under a lot of pressure when it comes to coming to a new place, to writing papers and exams. I hear about anxiety, depression, other mental health issues can increase and overwhelm students during their time in post-secondary education. We also know that every student is different. Every student's needs are unique, and that our colleges and our universities do their best to accommodate them. And that's why in recent years we've funded 34 pilot projects at different post-secondary institutions to help students who need mental health supports and develop innovative approaches. We funded Good to Talk, a dedicated helpline for post-secondary students. It's available 24/7. It provides direct counseling and referral services. And that means the world to me because government is here to help people. And when you listen to people, when you develop good policy, and then you implement it, you really can have a positive effect on their lives. And that's why we established the Center for Innovation on Campus Mental Health, a place where all institutions can access expert advice to help students with complex mental health needs. It's a resource for mental health workers and other professionals working with post-secondary students. This past spring, I guess it still is spring, earlier this spring, we provided funding to every college and every university so they could hire a dedicated mental health worker who provides direct services to students. But that wasn't enough. So today I am very, very pleased to announce an additional $6 million each year for the next 3 years for mental health services and supports for post-secondary students across Ontario. So that's on top of the $9 million a year we already spend. So it's a significant addition from $9 to $15 million each year. Those numbers, though, might not mean much to people. So let's talk about what those numbers will do. It will help colleges and universities develop and expand mental health services for students. It means more helping hands, more safe spaces, more top quality resources, more non-judgmental people to talk to. It will promote a greater culture of openness when it comes to talking about mental health. And of course, all that means is making the lives of students better. I'd also like to say to the students, we heard you and we hear you. You told us this was a need, and I'm very pleased we were able to step up and address that need. So thank you for being the advocates that you are. It helps us make a better post-secondary experience for students. I also want to say to people who are facing mental health challenges, we've come a long way in destigmatizing mental health, but we still have a long, long way to go. So I encourage people to step up, to speak up. If you need help, there is help for you, and we're going to make sure that there is. Thank you so much.
Thank you, Minister Matthews, for this wonderful news. This, as a mental health social worker, as a mental health researcher, and as a provost of this university, I am absolutely delighted to hear this news. This is really welcome and most needed on all university campuses. Let me move on to now welcome to the podium Minister and Dr. Eric Hoskins. After finishing his medical degree and studying at Oxford University as a Rhodes Scholar, Dr. Hoskins spent nearly a decade as a doctor and humanitarian in war-torn regions of Africa and around the world. Dr. Hoskins entered politics in 2009 after being elected as MPP for St. Paul's, and since then he served in a number of important ministerial positions, including Minister of Economic Development, Trade and Employment, and Minister of Citizenship and Immigration. He is currently the Minister of Health and Long-Term Care. Minister Hoskins.
Hey guys, everything all right? Well, we're going to find out if anybody behind me has orthostatic hypotension. For those of you who know what that means, they deserve all the credit for actually being a great backdrop, but it's never easy to stand in one place like that for a long time. And thanks, Cheryl, for that introduction. It shows you can get a great education and still, after all of that, those many years of post-secondary education that I obtained, still end up as a lowly politician after all of that. And but I want to say welcome to everybody here this morning. It's always great to be part of an announcement with Deb Matthews. She is so committed and dedicated to this cause, the critical importance of supporting those who are facing mental health challenges, as she is equally committed to post-secondary education for Ontarians. And I have a few things I wanted to talk about, which are also in the budget, which I think relate very well to the experience of young Ontarians, including the experience of young Ontarians who are students in our post-secondary institutions. And being a student, I think I can vaguely recollect it, it's an important time, it's an amazing time in your life, it's an important time in your life. But as well, all of us know, and Minister Matthews said, it can also be a very challenging time. You may have a heavy course load. Many of you are away from your families for the first time, which can be both a great thing but also a challenging thing. And you might or often are trying to hold down a job at the same time to help finance your way through your education. And so we know that in addition to the physical health challenges, we also know, as has been already spoken to, that mental illness often begins during those years. In fact, 70% of mental illness begins during childhood. And so those early post-secondary years can be challenging for a whole variety of reasons. So we need to ensure that you have the right supports in place to enable you to succeed. And through the budget that was announced last week, there are a number of initiatives that are going to do just that. First, and I know Deb and I are extremely proud of this, I want to mention one nugget that's in the budget from last week, which is OHIP Plus, which is Pharma Care for Children and Youth. And I'm going to describe that to you in this way. It means that come January 1st, if you are under the age of 25, you can walk into any pharmacy in this province with a prescription from your nurse practitioner or your physician, and you can get access to more than 4,400 different medications, the entire Ontario drug formulary that exists, and get those medications absolutely free of charge. No annual deductible, no co-payment, no fee attached, and it'll include the whole list of drugs, from asthma, puffers, inhalers, to insulin for those who might be insulin-dependent diabetics, to cancer drugs, to drugs for rare diseases. If you have an allergy and you use an EpiPen, you'll be able to get that EpiPen for free. And even for students that may be part of a college or university's private drug plan that generally often covers, say, 80% of the drug costs, that you can go into that pharmacy knowing that 100% of that drug cost will be covered, free of charge. And it begins January 1st. And then even after you graduate from university or college, although, some of us tend to go on for a long time, but when you graduate from university or college, we're going to continue to cover those medication costs until your 25th birthday. And we're doing that because we know the challenges that take place during these years. We know that finding a job, say with health benefits, is often a challenge, and it doesn't happen straight away. The second thing I want to mention is critically important, that Ontario is developing and implementing a province-wide, publicly funded, structured psychotherapy program that will include access for more than 100,000 more Ontarians to supports such as CBT, or cognitive behavioral therapy. And cognitive behavioral therapy, for those of you who don't know, is a proven technique, a proven service that can be provided by a myriad of providers, proven effective for those with mild or moderate mood disorders such as depression or anxiety. So we're the first province or territory in the entire country to do this, to invest tens of millions of dollars in a proven therapy that will enhance access to mental health supports that will help, as I mentioned, 100,000 or more Ontarians that suffer from mood disorders like depression and anxiety. And then lastly, students and other young persons will also benefit from the creation and expansion of up to 9 integrated youth service hubs. They're called youth wellness hubs. And they provide wraparound supports, everything from mental health supports to primary care to social services. It's like a one-stop shop for youth up to the age of 25 that can find a whole set of services that would help them have the supports that they need at that age. I want to, because I know she's here and Susan is somewhere, Susan Pigott. So shortly after becoming minister, created I think it was Deb's idea actually, and then I was the beneficiary of a mental health and addictions leadership advisory council, a council of roughly 24 individuals, the best of the best from across this province, including, in fact, and importantly, many people, many Ontarians with lived experience with mental health challenges and mental illness. And Susan Pigott is the chair, and she's with us this morning. And these initiatives that we're taking are specifically the outcome of the work that this advisory council has been doing over the past 2 years. And in fact, there's an additional one which I didn't reference, which is the creation that we're doing this year as well, adding another 1,150 supportive housing units in the province, which will bring, I think, our total to 16,000 units. And as Deb referenced, we have a lot of work to do still. We still have many individuals in this province who require supportive housing, many of them facing mental health challenges. But this is the level of commitment of this government and the efforts that we're making. And I think as I conclude, I'm a medical doctor myself, and I'm a citizen of this province through both ways. I think all of us probably, either ourselves or through our friends or neighbors or coworkers, have experienced mental illness or know somebody dear to us, a loved one who has. It is so critically important that as we continue to make progress and reduce and eventually eliminate the stigma, that we recognize that there can be no health without mental health. And it's like physical health and mental health need to be two sides of the same coin. And we need to approach mental health with the same commitment and level of determination as we do with all of the other elements of our healthcare system. It's only by doing that that we'll truly make the kind of progress that Ontarians deserve and require, and we have the responsibility to provide. So, ladies and gentlemen, I'm so proud to be here this morning with you. Thank you for hosting us, University of Toronto. And Cheryl, I think back to you to move us forward. Thank you.
Minister Hoskins, thank you very much, and for the commitment that you're showing to the health of young people and the commitment that you're showing to those who suffer from mental health challenges. We know that if we're going to be successful in institutions of higher learning and supporting our students, we can only do that through tremendous partnerships with the healthcare and mental health care systems in the community. And so hearing about this is absolutely wonderful. With that, I am delighted to introduce Dr. Andrea Levinson, who is our own chief psychiatrist here at the University of Toronto and who works in University of Toronto's Health and Wellness. Most recently, Dr. Levinson came to us from the Centre for Addiction and Mental Health. And actually, just before this, Janine Robb, who is here, who is the director of our Health and Wellness Center, Professor and Dean Trevor Young, who is our Dean of Medicine, and I were reminiscing about the days when we all at the same time worked at the Center for Addiction and Mental Health, but in those days it was called the Clark Institute. So we are the old Clarkites, and you can understand just how old we are as a result of that. Dr. Levinson is responsible for the provision and management of psychiatric services here for University of Toronto students. She's been an active faculty member in the Department of Psychiatry since 2007 and was a resident in psychiatry before that here at the University of Toronto. She is also a graduate of our clinical science program and received her MSc for research in mental health. And she is no stranger to addressing issues of mental health in younger adults, and she founded the very successful early intervention clinic for patients with mood disorders at the Centre for Addiction and Mental Health. She is also not only a great provider of mental health services, but an extremely popular and talented teacher of residents and medical students, and comes to us with the whole package. Please come forward, Dr. Levinson.
Thank you, Provost Regehr, for your very kind introduction, and thank you, Ministers Matthews and Hoskins, for sharing your thoughtful comments. Today, I speak on behalf of all the staff who work on the front line, delivering mental health services and supports to post-secondary students. We are truly grateful, blown away, and thrilled to receive this incredible funding announcement today, which will certainly have a positive impact on all students and their mental health across our province of Ontario. We know that 3/4 of lifetime mental disorders have their first onset in the age range which really is found in the post-secondary environment, between the ages of 18 to 24. And this is the time when the early symptoms of illness often emerge. These early warning signs, if left untreated, leave young adults exceptionally vulnerable to worsening health, significant impact on daily functioning, and with more likelihood of disengaging from supports and leaving school altogether. We also know, and I found this astounding, that 83% of Ontario's emerging adults, or transitional youth, whichever term you prefer, participate in some form of post-secondary education. Our campuses are the workplace and also the playground of our young adult population. Students embarking on post-secondary learning go through a number of very complex transitions. They transition to a more stressful learning environment, they move away from home and daily family supports, and they shift to new life skill learning. Our students who previously may have had access to mental health care as children and adolescents require a shift from this pediatric system to the adult healthcare system. And it's right at the same time as they transition to campus life. Often they need to find an entire new healthcare team in a brand new geographic location. Post-secondary institutions have a real opportunity. We're really well positioned to play a vital role in bridging students from the pediatric to the adult healthcare provider. When young adults start to actually experience a mental health concern or an addiction issue, it's extremely challenging to navigate the healthcare environment. We know that ensuring easy and prompt access to supports on campus, we will improve students' health and their educational trajectory. I just wanted to highlight some recent survey data that was published in the 2016 National College Health Assessment Survey, which surveyed 25,000 plus post-secondary students from across Ontario, where self-reported rates were extremely high of symptoms of depression that were debilitating, severe anxiety, and thoughts of suicide over the past year. In addition, we gained data that we know that students registered with mental illness disabilities within Ontario's post-secondary institutions has increased more than 400% between 2004 and 2014. That's a 10-year span. Our government has a goal to provide health care in the right place at the right time for individuals. This incredible convergence of emerging adults on our campuses provides an unbelievable opportunity to facilitate early intervention and support for this key subgroup of our population. Our adults of tomorrow, who are filled with promise, talent, and a very bright future. Current wait times within our community and hospital-based mental health services are such that many students would be at serious risk of dropping out of school before they make it to their initial assessment. Our students require timely and flexible access to supports, as the school year has real timely demands. Over the last few years, many campuses across Ontario and here at the University of Toronto have developed campus-wide mental health initiatives and strategies with ongoing work in very key areas where mental health intersects with policy, with training, with awareness, with advocacy, and with service delivery. Universities and colleges have identified key mental health initiatives for students, and we've done some excellent work in implementing mental health education, training, and programming on campuses, which focus on positive mental health for all students. Finally, this tremendous support that's been announced today by the Ontario government around specific mental health funding to post-secondary settings recognizes, and it's really wonderful, and affirms the key role our campuses play in ensuring that our emerging adults reach their fullest potential. Thank you so much.
Thank you, Dr. Levinson. This announcement is all about students, and so it's only fitting that the anchor position is taken by a student. We have some wonderful student leaders who are behind us today. These students are making an incredible contribution to leadership and student life here at the University of Toronto. So they're not just set design, they are our leaders. I also now would like to introduce Mr. Matthias Memel, who is the president of the University of Toronto Students' Union. Matthias has a degree in music from the University of Toronto, and then he has continued with us and is now doing another degree in computer science and politics. Last year, he served as the VP International and Services, and this year he is serving as the President of the University of Toronto Students' Union. So you will see shortly that at another time in history, he will be here in the future. He will be at this podium as one of the other people making an announcement. But for now, Matthias will respond to this.
Good morning, everyone. My name is Matthias Memel, and I'm the president of the University of Toronto Students' Union. I'm here with my team behind me because when you're asked to talk about something as important as mental health on campus, you don't say no, especially when you have the provost and two ministers with no choice but to smile and nod at you. I want to start by thanking Minister Matthews and Minister Hoskins for this new initiative. It's truly incredible. I especially want to thank them for sharing it with us here at the University of Toronto first. At universities across the province, there's a desperate need for better, more accessible mental health resources at universities. And still, students at U of T face unique challenges. Our pride sometimes blinds us to the fact that the pressures of attending a research institution as prestigious and intense as the University of Toronto can make for, at times, a grim and soulless place. It can be an intimidating maze of bureaucracy, and seeking help, let alone finding it in times of crisis, can be next to impossible. My hope is that with more support from the government, we'll be able to bring light to the lonely and dark places where many students at U of T and across the province still suffer. I say we specifically because I believe that this is a shared responsibility, shared by the government, the universities, and student organizations like the University of Toronto Students' Union. The government provides the funding, the university converts that funding into resources for its students, and student organizations like the UTSU make those resources accessible to students. And student organizations ought to have input in what shape those resources take in the first place. Last week, a close friend of mine who needed help had so little confidence in the health and wellness services on their campus that he chose to go to CAMH instead. That can't happen. The resources that exist at post-secondary institutions need to have the full and complete trust of students, especially in times of emergency. That confidence can only be created when programs receive sufficient funding from the province so that organizations like the UTSU can, in good faith, direct its students to on-campus resources. And these resources have to be provided and custom-tailored by the university itself. Mental illness is one of the greatest barriers to success at university. It's also one of the most debilitating. Too often, students are left without solutions. And we at the UTSU have built a student health plan that is the best in the country for mental health coverage. But that's a piecemeal solution, and it shouldn't have been necessary. The problem is, in part, a lack of faith in the possibility of true partnerships with students and student organizations. And I hope that from this point forward that changes. I want to conclude by thanking the ministers, not just for allocating the funds, but also for demonstrating a serious and personal commitment to improving mental health resources on campus. I want to thank the provost and the university for inviting me to speak here today, and I hope that it's a sign of collaborative things to come. And finally, while I have you all here, I want to encourage the government and the university to treat student organizations not as permanent adversaries, but as potential partners in the creation of a better, healthier, and fairer post-secondary education system. We'll oppose you whenever we must, but we'll work with you whenever we can. So let's not waste this opportunity. Thank you.
That's why he gets the anchor position. Thank you all very much for being here. We all acknowledge that mental health is essential for all people, but especially for young people, as indicated by Professor Levinson. And in order for our students and everyone in society to fully realize their academic potential, their personal potential, and their life potential, University of Toronto is proud to have a wide range of services but has been indicated this is a big challenge for universities, and we need to continue to work collaboratively with our student groups, with the government, and with our community resources if we hope to be able to make a change in this really serious problem that we face as a society. I'm so delighted that Minister Matthews and Minister Hoskins were here with us today and choosing U of T to make this important announcement. We are delighted to be partners in this. Thank you.